important. This is about autism,
Yeah,
assessing patients with autism and some other considerations about that, because I think it's close to many people's hearts because of the family and something we encounter pretty frequently on the truck.
we're at that point where about every 1 in 36 children has been diagnosed now with autism. So that's a very, very close ratio. Uh,
Wow.
there are a lot of things that go with this, and they have, among other things, they have social interaction issues. They've got communication issues that we know well of. They have patterns, in what we call stimming, and flapping their arms or yelling or smacking their lips or whatever the case may be. And to us, it looks odd, but honestly, to them, that's their calming mechanism. So if you see it happening, you just let them keep doing it. It's not harming them. It's not harming you. But if you try to restrict them, that could actually cause more of a problem. Uh, they also tend to do some very unique things, and one of it is that they don't really know much about consequences. They don't consider consequences, so they tend to wander. If they're in a situation where they're overstimulated, they will do whatever they can to kind of get away from it. And they won't tell anybody. They'll just take off. They'll walk out the front door. They'll walk down the street. And they're attracted to a couple of different things. And they're not really quite sure why, but there's a very commonality between autistic uh, patients and their love of water. Right? It's that maybe the calming, aspect of the water, or the cool of the water, or just the sound, or whatever. I don't know what it is. Um, but that's something that you have to consider if you have a child that's missing or an adult that's missing. Is there any body of water nearby? Start looking there, because they may have headed toward it. And now, unfortunately, you may be dealing with a drowning. The other thing is that they tend to also like traffic, trains, um, automobiles. They hide in cars all the time because they think it's safe. So if there's a junkyard nearby, and the person took off, go look there. You might find them there, and they're hiding in a car. It's odd things like that they do, but it's very, very common among that population. Uh, the one thing that we may be called for quite often, just because it's out of the realm of what the parents can control or the caregivers can control, is what's called an escalation event. And this is where it's kind of like they turn into the Tasmanian devil. They get overstimulated. It's an involuntary response, and they just kind of blow their top. Now, most of these events occur on a daily basis, and we never get called for it. We've had them happen with my oldest nephew, and most of the time we just let him run his course, and he calms down, and it's all good. But any change in routine, any change in uh, activities that isn't explained, or if it seems to them to be very acute, they can just kind of lose a little bit of control, and that's what happens. They also get overloaded by stimulus. So you have to be careful with that too when you're going in and talking with these patients. Just your general, your cologne, your aftershave, your deodorant sometimes can be, to us, doesn't seem like anything, but to them can be overwhelming. The sounds that come from the ambulance. So the sirens, we tend to want to turn those down before we hit the scene. If it's at night, or if we're going to be taking the child outside to go to the ambulance or the adult, the lights sometimes can be overstimulating. So just turn them off. Touch, texture, they don't like to be touched. You have to explain everything 100 times as to why you're doing what you're doing. Let them touch your things. Let them see the texture and stuff like that. The other thing is, a lot of them are technology dependent, which is very advantageous because the technology is out there now where you'll have quite a few of these patients that are nonverbal, but through technology, they can actually speak. And for everybody that's listening out there, if you look up, she's on YouTube, and her name's Carly Fleischman. Just one example. She is completely nonverbal, but you can actually hear her talk because she is able to type on an iPad that then coordinates that, turns it into a voice, and she communicates that way. And that may be the way your patient communicates to you. So you're going to have time. You're going to take time, have some patience, let them use that technology to help communicate with you, and vice versa, so that you can, have a positive outcome for whatever you're called. Because they get sick, they fall, they have very poor, depth perception in some cases. My nephew thought he could fly out of the second-story window, and he didn't. Fortunately, the tree caught him before the ground did. And, so they do kind of crazy things sometimes that we get called for. So we take care of the problem that we're there to take care of. But those are some of the aspects you kind of got to remember when you're dealing with these patients, and then when we go to transport them. In very rare cases, does it come down to actually having to do any kind of restraint. Sometimes it may be necessary, but you have protocol for that. Otherwise, there's a lot of places, and you can look these up as well, where services have built their own sensory kits for the ambulance, and they have anything in there from like weighted blankets to Rubik's cubes, little spinner things that are there, which I love, by the way. So that's just one of those things. The fidget toys, all kinds of stuff that kind of keeps them focused, but also decreases their sensory input so that they can themselves become a little more calm and feel like they've got a little bit more control. And
That's great. That's great.
Again, they're kind of a unique population, but they are also, again, going to be those patients you are going to see. It's not a matter of if, it's probably when you're going to come across one of those people.